So, Assalamu alaikum everyone, and welcome all of you to the seventh basically lecture. So, for today we are combining two sections, section 2 and section 3. So, for section 2, it's going to be treated as a guest lecture where we are going to talk about biomedical signal processing and explicitly something about the biomedical electronics, which we call next generation. And for section 3, it's a normal lecture where we are going to talk some biomedical signal processing, developing on top of what we have learned the skills, now applying to some further biomedical applications, and followed by a lab. So there will be a lab part as all the time, but I will try to wrap like in 30 to 40 minutes or 40 to 50 minutes the lecture, and then we can have the dedicated lab sessions. So for lecture lab section 2, you can do the same way you normally perform your labs in your dedicated Zoom sessions. And for section 3, I will launch the breakout rooms and you can join your respective breakout rooms. Just again, if you have any concern, query, please make sure to write on the chat. I will check intermittently, and also you can raise your hand if you want to talk. Right. So I guess we are going to kick off. So the topic at this moment is next generation of biomedical electronics. And this is the way which I feel like the biomedical or electronics or all the medical devices in hospital should be turned in next decade or so. That's why I call it as a next generation. In this lab, definitely we cannot bring electronics, but we can work on those some signals which we have acquired from our surrounding, we can have acquired from our systems, and then we can do some processing. So we can do the same processing on MATLAB. So when I talk about the next generation of healthcare system, I feel some things are missing in our current scenario whenever we even do the research in the area of wearable or portable applications. For example, you measure temperature. So you measure your temperature, you are in home monitoring your temperature, you can monitor it. What is the feedback? You know if it is above 100 or somehow you want to take a Panadol or you want to do relaxation, or if it is much higher, 103, then you might need to visit a hospital. Or if it's around 98, so everything is fine. So something like you have some feedback intuitively inside for that range. But for if we go for some complex diseases, for example, of epilepsy, autism, cardiovascular disease, other neurological diseases, diabetes, we don't have that much system integrated in our devices. So we want to have a neurofeedback system. When I'm calling it a neurofeedback, it doesn't mean it should be some specialized sort of system which is going to give a feedback. Any closed loop system which is going to give the required feedback. It can be biofeedback if you want to give name, or it can be just a feedback, but the purpose that there should be some sort of feedback which can facilitate the patient, the caregiver in making or relieving the patient. Then we also work on the development of these smart sensors. So if you want to have some gadgets on your body or you want to wear it for a longer time, then the design is not as straightforward as the devices around. So we need to have some specific attention on the acquisition and all the things. So we work on those areas too in our lab. Right. And then the third one comes the portable biomedical devices. So apart from those wearable systems, we also work on those devices which you can use in your homes, but you don't need to monitor some disease, some abnormality 24/7. So normally I call them as portable biomedical applications. So in home monitoring, for example, a breast cancer screening machine, if you have some, so a person don't have to visit hospital for a regular checkup. So it's an early screening machine which can be utilized. Again, something similar to simple thermometer, a glucose monitor. So not that much complex. And then since we are talking about these wearable or portable applications, we want to run them for a longer time. So we need to basically operate them. And for that, we cannot use just a coin cell for a longer time. We need to harvest energy from our surroundings. So we call it as energy harvesting. If it is going to be from solar, from your own sweat, from your movement. So somehow you need to harvest the energy from your surroundings. So work on those electronics too. So that's why I call these as the next generation of healthcare system. So shifting the trend from the hospital to the patient itself. I wouldn't say shifting outside the hospital. I would say giving the control to the patient, who is basically the main sufferer, so he can help in curing his disease, so he can play his part, because he's the one who is suffering somehow. Whenever you are suffering, you find out a problem that is suiting you. So there should be a role of the patient in providing a solution. So that's the whole idea. So what is the motivation basically for this biomedical or the next generation of systems, biomedical system, which I'm calling it? If you see the chronic disorders around us, is the leading cause of death. And what are those chronic disorders? Which remain for a longer time. It doesn't go, for example, if somebody have a type 1 sugar, it remains with him, he has to live with. So it's a chronic disease. Same thing, epilepsy. If you don't remove that, whatever then the part of your brain which is causing that epileptic seizure, you have to tune your life accordingly. You have to take remedy, but it's going to stay for a longer time. So those diseases are chronic. So these chronic diseases can be definitely their effects can be mitigated, but that's a leading cause of a death. For example, cancer, neurological disorders, cardiovascular disorders, and all others. So the issue with them is, for me, that because these diseases, it's cardio disease or cardiovascular, is not only one single disease. It's amalgam of multiple diseases. For example, stroke is there, coronary heart disease, myocardial infection, heart failure, angina. So it's a combination of a bunch of diseases which need specialization. And that's why if one person is trying to sort out all of them, the person cannot be perfect. So we need some more specific solution so that we can bring down this leading cause of death to change the horizon. Something similar about the neurology. We talk about neurology, but then it's a whole new science. Every disease itself is a whole new chapter. And then when you open any new person having that disease, that has a different overall patterns. So it's not a straightforward thing. We cannot use conventional tools to sort out these complex diseases or these complex chronic disorders. So that's why we need to work on the conventional ways. So the conventional ways are what? They are pharmacological therapies, which have limited efficacy, meaning you go to a hospital, the person measure your vitals. If you are a cardio patient, he will measure your ECG, do some further tests, and then will advise some medication. You take that medication. If things get controlled, well and good. If not, then he will change your medications. So this is a pharmacological therapy. Same thing applies for any other disorder. Then the secondary or another category comes the surgical therapies, where, for example, you take medication, but it's not sorting out. So the doctor said you need to have angioplasty or angiography. So that's our open heart surgery. So that comes into the category of surgical therapies. Surgical therapies have good efficacy, but there are a lot of challenges or issues involved with those things. And apart from its efficacy, it's better than pharmacological, but not the ideal one. So these are the issues which we are currently living in. And if you talk even these surgical therapies for the neurological disorders, nobody want to do the surgical therapy for something, because nobody want their brains to open up. They don't want somebody to drill in the skull, because that itself is a very much dangerous activity. So these are the issues involved in our system. So that's why, for me, I want to find some other solution and somehow to improve this pharmacological therapies, or find out what is the correct way or what is the correct point where we can interact with the patient and try to cure him. So I take this on as a double E electrical engineer. I take this is somehow mistake on the double E side also, that we focus too much on the technology and we left the humanity. Humanity means when we need to bring the real humans and health about the real humans when we are dealing with the technology. So again, it's not only my mistake or only double E mistake, it's everyone, but everyone has to accept their own, what they might did wrong and what they can improve. So for example, the first wave of in EE came about the computation about 2 or 3 decades back, and that was mainly targeting about this computation. We need to do all this computation in a very much small area. We started with the room sort of stuff where we were doing just simple multiplication and addition, and now we reach to a point where we have power in our hand of all the processing. So what we wanted, we achieved it. It took a couple of decades or more than a couple of decades. So if you have any question, please do raise hand or write on a chat box. So that was the first wave in the EE. Then comes the second wave. The second wave was basically which we call the second wave of the communication, where we want again the communication to happen. We want the distances to squeeze down. We want that we can communicate to the persons who are far from us, and that we achieved it. Nowadays, we did this like past 1.5 years using these two waves, or the benefit of these two waves which we had prior. But I'm not saying that we did something wrong, but the third wave, the third thing which was left was healthcare. If we had done might be something similar what we did in the computation or communication, we might not have to suffer that much what we did in last 1.5 years. Just a simple example. So revolution in healthcare now has started. Definitely people start working on it. People start realizing that that's something which we need to work on the emergency basis, where we want to take again the patient from this point where he's in the hospital, measuring all the vitals for even simpler things, to have some wearable or portable devices which he can wear and move and perform normal life activities. So this is like a basic interpretation, the way from this phone going to this gadget, and so from this hospital going to a very much small module which the person is wearing and measuring his vitals. So that's the whole idea what we want to do. And what it is basically this clinical hospital. I all the time say that if you have a time machine, you go back 30 years, and if some person have a chest pain, they will directly take him to the hospital, and the doctors will record his ECG and tell him you might need to stay for a day so that we can measure ECG. Okay, well and good. You don't have to take a time machine. Just go to hospital and tell the doctors you have a chest pain. They will do the same thing. They will measure your ECG, and they didn't find anything. They will tell you need to stay for 1 day in a hospital so we can measure your ECG. So for very simple thing, which is ECG, we cannot have digitized, at least in Pakistan, we cannot have a digitized record. We cannot have a machine, a portable wearable machine, which a person can go in a home, do normal activities. And again, I'm not saying sit at one place or lay down, cannot like do normal activities, because that is the real essence. The person has pain when he was doing some jogging. The person has pain when he was moving, he was under stress, not like when he was laying down. So that's something which we need to bring in our systems. So we brought this mimicking these like a portable machine where you have the stress test and all of the things, but again, they are not replica of what we want. So we want something which is realistic, which can mimic the realistic information, realistic picture. So that's what again I'm calling the next generation of healthcare. But the important thing is that it's not just about the fashion, that you can bring each and everything, and you want to have electronics or the wearable system for any disease. If you have, for example, cough, you want to monitor it continuously and you need to have a wearable device. No, the disease has to tell that, okay, there is some requirement or the chronic nature of the disease is such that needs continuous monitoring. So that's why we need a wearable device. So for example, this is a pattern of a diabetic patient who is basically diabetic. So he's measuring his or her glucose level around the breakfast and the dinner time. So for example, A and B are the breakfast and the dinner point. So during those times when he measures his glucose level, they come out to be normal using the conventional, the finger prick method. So he just prick his finger, take out blood using the glucometer and measure the value of the glucose. And he thinks he's perfectly normal, everything is in the range. But in reality, what's happening beyond these A and B all the time is sugar level is pretty much high. And that's the main issue. That's something which we need to look into. So for such persons, for such disease, there is some requirement of a continuous monitoring. And that's what we are working on. Okay, we want to target diseases like this. For example, glucose is one of the case, epilepsy is another one, autism is another one, some cases of cardiovascular diseases are those. So we want to work on these things, and we want to work on wearable electronics, which for me is one of the solution, but again, beyond wearable now even. And also this links with the 4 Ps of medicine from the National Institute of Health, that your any solution or any disease or any pill should be predictive. It should be able to predict like what's coming on. It should be personalized, so it should be specific to one person. For example, the solution, the cure which is provided to me might have a different overall template as compared to anyone else having the same symptoms, because my body requirements are different as compared to someone else. And that's somehow we also call personalized or the patient specific thing. Then the preempt. So it should also preempt. One thing is predict, one thing is preempt. How you can preempt the things before they will happen. That's something also we need to link to it. And the final and the main thing is the participatory, where the patient can itself participate, where I was talking about the feedback system. The patient can take role. Not only he just have to participate when he goes to the hospital and talk to the doctor in an interview fashion. No, he should be able to actively participate in his cure, in his process. So these are the things which we need to bring on any device should have these things for any meaningful solution. Again, that is assumption which I am building on, and somehow that's till now it has proven that it gives better success as compared to the conventional ways. So just a little brief history about wearable electronics, how it all started. If you remember, or if you know that conventionally in our hospitals or even the state of the art or the standard practices, they give you a Holter monitor. Holter monitor is record your ECG, but doesn't. It's a limited version, and it mainly records your blood pressure values. So the idea behind the Holter monitor came out from a person who has the same idea which we are talking about now regarding this wearable thing, that when he goes to hospital, they measure his blood pressure, it comes out to be normal, but he thinks there's something wrong. And though something wrong is when he's doing normal activities like driving a bicycle or moving or running or working under a stress condition. So then he said, okay, why not I wear that all machine, which is measuring my blood pressure all time. And he called, his name was Norman Holter. So that device, which he that time formed out, was known as Holter monitor. Initially, it was a bigger size. Now it's a relatively smaller size, which we use in the hospitals. It measures your blood pressure for 24 hours and keep a paper record sort of stuff. Improved version definitely have the e-records, but this is somehow the way it started. And then also, similar the way computers started, person start putting the desktop system, carrying it, and now they have laptops, they have gadgets, they have pads, so they have each and everything. So it's the same analogy. We started even on the idea also to show here, we started for the health way back then, might be we started doing this processing, but we did a lot on this one because there was a craze, there was a market, or there was money was involved in doing this thing as compared to the health, since health is our least priority. But now we might have realized that if we don't have good health, we don't have ultimately anything. So also a couple of, not only couple of universities are mentioned, but good amount of universities worked on bringing these gadgets, doing the research, like putting all the hardware, making wearable, even starting with the wearable by carrying the things in your laptop, by having this augmented reality. So if you see this augmented reality, how it started, now you have those Google glasses. Same way you saw initially, like recording your PPG signals or heart rate are difficult. Now everyone has those smart watches, and that has all information about your fitness at least. So one step ahead. Then we're having a smart jacket, which is measuring your ECG, rather the point which I was measuring, or which I was mentioning, going into the hospital and having that, rather doing recording remotely in your home in a normal condition. But the thing is that currently we are now, from a couple of decades, things are working, but still these things are in the research phase. People are working on it. They are continuously improving. Hardware doesn't come like you have to write something, it comes out. No, it takes time. And it's something which is involving humans, real humans. So this needs significant care and approval process. So the things are coming, and the robustness and those all criteria is under progress. But this is one of the direction which is currently moving on. For us, what we do, device miniaturization, we need to make it shrink it as small as possible so that we can achieve continuous monitoring. So we work on the area of integrated circuit design, which we call IC design, somehow similar the way your mobile processor, your laptop, every processing or any electronics which is currently is consumer electronics is built around you is basically IC. So we do this IC design at EE department at Lab7, and we want to operate it for a lower power. Lower power means so that it can work for a longer time. So IC should be power efficient so that we can operate it for a lower power, and then that I call miniaturized medical device. So for example, I can give you the ECG one, which I was just mentioning. So how and what are the things will be included in the system? So we will have some ECG patch, for example. We require the ECG data. We'll process it in the front end, which we normally call how we process this data. Then we digitize it. Then we do some processing, and finally we communicate to the external world. And also for the feedback, we can have some stimulation mechanism. So this is the overall idea which we try to implement somehow similar for all other systems, right? So I will take a couple of minutes pause here. Meanwhile, if you have any concern, question, please do ask. I know it's a generic one, but I would really like, so if you have any questions in your mind, please do ask before we go a little bit towards some different type of signals and then later on to the specific tasks. You can also write on the chat box if you have any concern or question. Right. Seems to be we don't have any question. Even if you're writing, you write it. I will take a pause once anyone has written the question. So let's move forward meanwhile. So for, as I mentioned, we want to give a patient somehow similar or a better environment or a better procedure what one person have in the hospital. So for that, we need to have multiple things integrated. The first thing is the biopotential signal acquisition, which is normally conventionally called as when you acquire the data from, for example, in case of ECG, from your body, how you're going to get that data. Okay? So that is known as signal acquisition. And biopotential, since everything, whenever we connect electrode to our body, like these are our electrodes, when we connect these electrodes to our body, ultimately, these are forming a biopotential. Okay, so a voltage, biopotential signal, which is going to be converted into voltage or a current through this electrode, which is a transducer for us. So this is the conventional ECG signal. So we want the biopotential signal acquisition system to be integrated, followed by feature extraction. So what is the feature extraction? Since now we are working on a very much small system, which is constrained by power and area. So we don't want all processing to happen there. So we need to have some specific features to extract. So these are some of the features which we normally call, for example, like here, RR stands for distance between these two peaks, QS, how this template is looking like, what is the amplitude of this small wave, what is the amplitude of this down wave. So all of these things counts basically. So we normally call features. And then once we have these features, we want to classify the system based on the features, meaning is it normal, abnormal, or whatever, if we are finding out a value, so we can do this thing. And finally, we want to have some stimulation, we want to have some feedback, we want to have some recording. So at this moment can be in the form of a display or feeding back to the doctor. So this is somehow what we ultimately look into it. So the common signal types which we look or work in our lab are basically contact based, which I just showed, electrode basically connected to electrode. And the other category is the contactless. At this moment, we work on the optical detection. So they are commonly known as photoplethysmography. And today's lab is basically focused on this photoplethysmography. And the contact based, we have basically the ECG signal, which is commonly used for cardiovascular diseases. Again, electroencephalogram, which is the EEG, the brain signal, which is basically for the neurological disorders, and then the electromyogram, EMG, for the muscle movement or for any other abnormality related to your movement. So these are basically broad categories which we work, but there are a lot others which people are looking into it and you can explore. But today's focus will be on the optical detection. I will go into this topic in just a moment. I will briefly describe this ECG and then I will go into the PPG signal. So for the PPG, mainly it can help us in a lot disease detection, specifically in the current scenario. For example, asthma monitoring for asthma patients, we can measure the oxygen saturation, which we are going to do in today's lab. For the cardiovascular diseases, heart rate and its variation, which again, we are going to focus in today's lab. For the cardiovascular, you can also use the same PPG data for measuring the blood pressure through the wrist ECG. And also you can use for the COVID-19 patient. If you remember, the biggest issue when the hospitals were populated was that the persons were COVID positive, they don't have any symptoms or even they have mild symptoms and they just need to be monitored so that they can monitor their blood pressure, oxygen concentration, respiration rate, and heart rate variability. Why not we can do that time those things at home? Because we didn't have, apart from that SpO2, we didn't have one, again, collective system which can do all of these jobs together. So that's why if we have some wearable device which can do this job, or we can quickly form a device, then definitely it will be very much optimistic solution in all time. And still, we don't know what's coming in the future. So we need to be prepared for anything. So that's why we are focusing on the PPG signal. So I will skip a couple of next slides. So I will focus directly on the PPG signal. And for ECG, EEG, or EMG, if somebody is interested, they can directly contact me, or we might have a separate, might be in your project, or next lab will be focusing on this ECG or EEG signal, and then we can explicitly talk about these signals. So I will just a bit skip these ECG and EEG, but I'm coming to the PPG, or which we commonly call photoplethysmography signals. So the good thing about the PPG is the non-invasive. The non-invasive means it's not, you don't have to prick anything. You don't have to make a scar in your body. It's not like, it is again, top of it, it's contactless. It's not touching your body. It's not making any contact. So for example, those electrode-based systems are also non-invasive, but those systems are contact-based. So this is contactless and non-invasive. You can say your finger is basically getting in contact, but at this moment you can also have where you don't have to put your finger, or the finger is going to touch anywhere. But the mechanism underlying is not depending upon the contact. So what PPG do? The interesting thing is it detects the changes in your blood volume. So your blood volume is basically get oxygenated, deoxygenated, oxygenated, deoxygenated. And that oxygenation, deoxygenation reflect into systolic and this diastolic pattern, systolic and diastolic pattern. So the PPG basically ultimately try to detect this pattern. How? Whenever we pass some certain light through our body, through our, for example, finger, so the blood is continuously systolic, dystolic behavior is falling. So whenever the light is going to pass and we want to observe on the opposite side how much transmission happened, or on the other side how much reflection happened, we can say some part of light is going to be absorbed. And the absorption is going to be depending on totally that patterns of systolic or diastolic. For diastolic, the blood volume is less. For the systolic, the blood volume is more. So more, if the systolic blood volume is more, less transmission. For more, for diastolic, when the blood volume is less, more transmission. So based on this one, we can detect this pattern of the signal, and we call it as a PPG signal. We can use certain wavelengths basically to do this job, but in this work we are using red and infrared to do that job, and we can get a pretty much good signal. So for example, the principle, if you want to go like an underhand how the things are happening, the attenuated light, basically when it passes through the your blood volume, so the light is going to be generated, it will pass through this artery and the veins where the systolic and diastolic behavior is happening. It will pass through this one and it will reach to a photodiode. What photodiode or photodetector is that it will convert a light signal into electrical. Okay? So this will take a light signal and convert into electrical signal, current here. And that current, which we can measure, so it will have a different behavior when we are passing through a oxygenated current, oxygenated blood, and when it's going to see a deoxygenated blood. So that's the main mechanism here. So as I mentioned, it can work in two modes, the transmission mode and the reflection mode. And transmission is here and the reflection is here. So on the reflection side, you can see it's more optimized in terms of area, where both reflectors, both source, the LEDs, and the photodiodes are on the same side, whereas on the transmission mode, they are on the opposite side of the finger. So both have their own benefits, pros and cons, and we normally focus more on the reflection type. Right. Any concern again? Any question? So just make sure if you have any concern, please do ask. Otherwise, we'll keep till the end some follow-up questions. So if you want to see pictorially what's happening, we can have two different wavelengths. So we at this moment we're using red and IR wavelength, 900 and 700 nanometer, basically 660 to be exact. So we are using two wavelengths, and at different wavelengths, different absorption spectrum is being observed, and that absorption spectrum is converted into relative currents from a photodiodes. Okay, and then we use some circuitry so that we can detect basically those currents and we can map into some useful signal, because this is just a signal which is a current and we don't know how to deal it. How we can use this one by using this electronics, or we commonly call it an amplifier and an ADC and some filtering, to try to have this positive or a clean signal. So for example, this is the same LED driver which I was just mentioning, having two LEDs, 900 nanometer and 600. So IR and red we are using, light is being passed here. We have the photodiode on the opposite side. So this is the photodiode here. So that diode is ultimately providing some current. So that current based on this absorption or reflection is being produced here. And this current is passed through an amplifier. So this is just, don't get confused with the name. So it's just an amplifier and then some filtering. So we get this data, and then we all know we need to digitize because we want to do the processing. So somehow which the data is provided to you today, that is also digitized data. So we need to have an ADC. And then also we have some feedback mechanism for cancellation of DC value. So we can also cancel the DC at the analog or the processing level. So that's somehow the mechanism which we are using. So coming to today's lab. So today's lab is basically developed by your senior students. They are already graduated 1 year, 1.5 years, or 2 years back rather. So what they did basically, they developed this complete hardware in discrete component, not in a minitized form, but in a discrete component. So they have two LEDs. The light was passing through their finger. They have the photodiode. The photodiode data was passed to an amplifier so that they have different type of amplification. They did some sort of filtering, and once they did filtering, they passed this data to a microcontroller for digitizing, and then they did the processing in a MATLAB, and they finally displayed their data. So today, for you, what it is, you are not going to do this job, which is on the top corner, but the focus of today's lab is the down one, rather this MATLAB processing one. So we are giving you this digitized data, which is basically a PPG signal from IR and red, and you are going to work on it. And one interesting thing, in order to share the same amplifier, same LED driver, we are time multiplexing the data. For example, for some specific duration, red LED is working, then specific IR, then red, then specific IR. So you need this phenomena is normally called multiplexing. So you need to demultiplex data in order to do the processing on the hardware side. Because of this multiplexing, we can reuse the same hardware if we are operating at a lower frequency, which is the case here. Right. So before mentioning about the specific tasks, I will just elaborate one of the video which was again done by your senior students in our lab. see if it plays. So for example, what's happening here, this is the PPG data which is coming from a finger. So this finger clip was also developed here, going to this amplifier. This is the processing unit. Basically, data is digitized and passed to the MATLAB. So at this moment, here the PPG data is coming, which is being displayed, which is also provided to you. And in this experiment, explicitly, the PPG data is used to find your glucose value, the sugar level, which we were showing. So they are also doing, they're also showing for that purpose, not only for the SpO2 or heart rate, you can use for some complex problems like blood pressure, like glucose values. So in this specific example, they are doing it for the glucose estimation. So they can estimate your blood glucose level and in a non-invasive manner, not using a finger prick, rather than in non-invasive manner. So you can see the PPG data is coming in a pure sinusoid and the overall glucose level is coming. Right. So hopefully in the next setting, when we are more towards what we call it an in-person environment, we can do these sort of experiments. We can play with the hardware and we can do less processing, more instrumentation. That was the main essence of this E100 biomedical flavor. But currently, due to the COVID limitations, we were forced to do this signal processing mode type flavor. So let's coming towards the specific task. The lab manual is already shared with all of you. So it has again 3 tasks. Today we don't have any bonus tasks. So for the first task is again basic signal processing. As I mentioned, we have the data which is already multiplexed. So you need to demultiplex data before you can start doing processing. So you need to display the data and you need to say where you need to demultiplex. So you can demultiplex the data into red and IR, DIR, infrared LED signals. Then you need to get rid of the offset rejection because all of them have a DC value. Though we have some DC rejection, but still that DC rejection is for the amplification purpose, but still there will be some significant DC value which will be in the system. So you need to get rid of it using some processing techniques. Then comes the signal smoothing using moving average because there is some noise, high frequency noise in the signal. So you need to get rid of that high frequency noise. So coming to the first part, demultiplexing the signal. So you are provided the data which is time multiplexed in the time domain. So signal A and signal B. So you need, there is some time separation. So you need to basically separate that, like one in the red and one in the IR variable. So you need to store that data and then you have to display them independently. And then, for example, in the real, you might find the data somehow similar to this one, where for the first 10 seconds, it's a red LED, then there's a 20-second separation followed by a 10-second IR data. So you need to separate this 10-second data and this one 10-second data. For example, when you do the separation, it will look somehow similar to this plot. Now, if you see, this is like an offset to around 9. So there is a DC value which is added to the signal. So you need to get rid of this DC value by doing some DC rejection, like finding out the mean and getting rid of that mean value somehow similar which you previously did, because DC value is the average value across all the signals. So we are subtracting that average from the signal. So it will take out that DC value. Then comes the signal smoothing using moving average filter. So signal smoothing is basically you can use multiple ways of signal smoothing. If you have prior, I'm not sure in which lab your section you performed the low pass filtering, but you can use either low pass filtering to get rid of the signal, to get rid of the high frequency components, or you can also utilize that moving average filter in a sense that encapsulates the high frequency components and try to smooth up your signal. For example, if we see this, the COVID curve, which is provided to us by the World Health Organization for Pakistan, for example, if you see the time, like a stem sort of the plot, daily update, how that look wise, it's not smooth, it has sharp edges. But if I do a 3 days moving average, you just click here and 3 days, it's like try to smooth up this curve. And if you make a further, further move in like 7-day moving, so you'll say further smoothing of this data. So you can apply some similar techniques for the signal smoothing in today's lab. So for the 7-day moving average or 7th order moving average is taking the 7th value prior and then taking average of them so that it gets rid of those common errors or try to suppress them basically, which are the common issues. So that's the way we do normally smoothing. So this is the task 1, which is you just need to do data visualizing, separating, doing offset rejection and data smoothing. Then followed by, again, you can use the command which is provided to you. So the description of the command is in your manual. So this is the explanation of the specific task and you can, I guess, pretty much do it. Then comes the heart rate estimation. So as I mentioned, we can use PPG signal to estimate our heart rate or heart rate variation. So if you see the ECG data, this is the top one is the ECG data, which you like telling about your heart. And these are the periods when your heart is pumping. Sorry? Can you say again? Right. Might be for the glitch. So if there is something you want, you can just write on a chat. So if, for example, these are basically those when the systolic or diastolic behavior is happening when our blood is pumping from the heart. So then these peaks are coming and these peaks are equivalent to basically the beats per minute. So if we count these number of peaks in a minute, then this is the beats per minute, which is 60, 70, or 80 for a normal healthy human being in the adult age. So correspondingly, PPG also has a peak, and these peaks might be a little bit time shifted, but the count of these peaks in 1 minute is equivalent to these peaks. So we can get the heart rate based on these peak information, and that's what the heart rate estimation for today's task you are going to do. So you can do 2 ways. Basically, you can do the frequency transform. So if you take the frequency transform using the previously provided function, so you can just directly find the frequency that okay at which frequency the maximum amplitude is, and once you find that frequency is basically inverse of the time. So inverse of that multiplied by 60 will give you beats per minute. So you can also find from this number. Rather, this itself is not inverse, itself is the beat frequency, but in seconds. So you can just multiply it by 60 and it will tell you beats per minute. So sorry for the typo, because this is a frequency. So you just need to multiply this with 60 and that will give you your beats per minute. Or the other mechanism you can use in the time domain by counting the number of peaks. So for example, if this is the time domain plot, and if you count these peaks and divide by the number of time multiplied by 60 for minutes, so it can also tell you the beats per minute. So somehow like these are overall, let's say how many number of peaks divided by time in minutes. So 10 divided by 60 and number of peaks. So that will also give you somehow similar number of or beats per minute, which is required. So you can use the peak detection function. Either you want to write your own, or you can use the find peaks built-in method of MATLAB, which basically helps you in finding the consecutive peak. So you can set the distance, or you can set the size, and you can just play around with this function, how you can find these peaks. So the second task basically move around the FFT one, the frequency one, and then the time domain beats per minute detection using the find peak function. So you can look into it, and then you just need to find out these things. The third task is a bit finding your oxygen concentration. That's also revolving around the same frequency transform DC value, but how it works, basically it's working on these two wavelengths, the red and the infrared. That's why we need 2 wavelengths data. So it's using this formula, but this formula is doing at this moment, you don't have to go again into the fundamentals of this one. So we're just providing you, and you just have to use this one. So what it is doing, it's finding the amplitude of the AC of the red signal. AC means highest AC component. So for example, this highest value, again, not about the frequency, about this amplitude. So whatever this amplitude coming, divided by the DC value of this red wavelength. DC value means at a zero frequency. So at a zero frequency, whatever is the amplitude, so you need to divide these things, divided by basically ultimately the AC of the infrared signal divided by the DC of the infrared signal. So you need to do the same thing again and again, and we call it ratio of ratios. So this is the ratio of the red signal divided by the ratio of the IR signal, and ratio of red means ratio of AC by DC, and ratio of IR means ratio of again AC by DC. Again, the description is in your manual. Make sure to go through it. If there's something clarification required, please do ask now or in a later time. And again, a pictorial representation is provided to you, so you can see what you need to do. Again, you can ignore this Lab4 thing, might be local maximum. You can just apply how you can find the maximum value by just seeing the peak amplitude wherever it's coming. You just need to find that peak amplitude somehow, which was mentioned here. So this is the basically the maxima which I mentioned. And so the DC value you can directly take at a zero frequency. You need to divide them. Then once you have these two values, you just have to divide both of them, ratio of red by ratio of IR, and apply that in the formula, and that will give you some SpO2 oxygen concentration. So again, we were assuming that things will open up, and we can, now they are somehow opened up, but in a future version, you can measure your own SpO2 by applying these algorithms and acquiring your own data. Right, so I guess the instruction wise, we are almost done. So we have 3 tasks, no bonus tasks. So you need to work on all of these 3 tasks. Again, these 3 tasks are relatively basic, not much advanced. So you can apply the same techniques which you have learned on, but now today we try to apply on a complete new type of signal, which we called in biomedical as a photoplethysmography or a PPG signal. And it's pretty much famous because of a lot of capabilities it has and can be used for multiple disorder detection. Right, so I will open up for any question, concern, GOS.
Assalamualaikum, sir. Sir, what is 108 minus 24 depict in this equation?
These are basically the constants, which are like through an empirical formula. They did some like a linear regression sort of stuff and mapping, and they found out these constants. So these are some constants which are basically developed how the things can be linked with your SpO2 value. Okay? So at this moment, these are constants which we are going to use in our system. So they are numerical values. Okay, they can be based on, once you develop your own algorithm, might be you take a data of some specific persons which are might be children. Okay, so usually you might need to play with these constants. So you will have your own algorithm, and in algorithm you will find some constant value. In this specific algorithm which is being used here, so the constant values are 108 and minus 24. If you are interested, I guess some details of these constants are not provided, but the link is provided. I can also provide a little bit detail if you are interested.
Okay, and sir, can you please explain again the task 2 by frequency method?
Right. So, for example, let me go back. Yes. So if you have done your frequency response, right?
Yes, sir.
Right. So in frequency response, when you take the frequency response of a signal, amplitude response, if you see, you might see one peak in that signal. Okay? So your peak value hogi, that will be the frequency, or that will be the frequency content which is repeating the most of the time. जिस तरह हम जब साइनोसाइड का सिंगल टोन देखते थे तो सिंगल टोन कम्स, वो सिंगल टोन वो सिग्नल था जिसपे वो फ्रीक्वेंसी बीट हो रही थी ऑल द टाइम. तो इसमें जो फ्रीक्वेंसी उसकी कार्डियक फ्रीक्वेंसी होगी, जो रिपीट मैक्सिमम हो रही होगी, उस फ्रीक्वेंसी के अक्रॉस मैक्सिमम एम्पलीट्यूड आ जाएगा. सो इस केस में वी जस्ट नीड टू ड्रॉ अ लाइन कि अगर ये मैक्सिमम एम्पलीट्यूड है, व्हाट इज द फ्रीक्वेंसी अक्रॉस दिस वैल्यू. इस अक्रॉस अगर आप फ्रीक्वेंसी देखेंगे, दैट इज एट दिस मोमेंट 1.6 हर्ट्ज. सो 1.6 हर्ट्ज इज बेसिकली beat per second. So where I was confusing, or I just said wrong, beats per second. So इसी को अगर beats per minute करना हो, you will just multiply with a 60. So it will tell us the value in बीट्स पर मिनट। ठीक है, तो आपने सिर्फ इस फ्रीक्वेंसी को जो आ रही होगी उसको 60 से मल्टीप्लाई कर देना है, एंड दैट विल बी टेलिंग यू द बीट पर मिनट वैल्यू। इज इट क्लियर?
Yes, sir. ठीक है, thank you, sir. Thank you very much.
Any other concern or question? So what I will do for section 3, I will start making the breakout rooms, and for section 2, if you have any question, you are free to ask now, or you can even come and rejoin. The session will be open, and for you can now join if you want. You can join your own individual Zoom rooms for dedicated TA sessions, whereas for section 3, I am opening the breakout rooms and you can join those. And I also request the TAs for section 3 to join their respective breakout rooms. I launched them. And again, I will be available for any concern or question related to this specific lab or journal. If you have, please, you can ask.